Yeah, actually there was no really like parental pressure lah, or I would say like no family pressure lah. Actually no lah.
Okay.
Not like a typical Chinese family. Oh, you must be a doctor, you know.
I don't know why the accent come out.
As a young child, I do follow my dad and a few of the church people. We go to hospitals. Yeah, and then from that point on, you see all these very sick people, very sad looking. You know, that time I really felt that there was a passion in me that really want to embark on this profession. After so many years, I still feel that it's the right choice lah. Despite many circumstances, despite many pressures in workplace, I think as long as the passion is there, passion is right there, your focus is right there to bring about a change in someone's health from bad to good, and then to see how you can actually influence them in their life. I think that's a powerful thing to do.
Welcome to another episode here on Feel Good. I'm your host, I'm Joking, better known as Kim, and in each episode, we try to spread a little bit of positivity lah, huh?
Alright.
Okay, today, I'm going to mention this once saja, huh? Once saja.
Okay.
I promise, once saja. Today in the studio, we have Dr. Ben, but from now onwards, I'm going to mention just Ben because he said he's off work, so he's not a doctor now.
Yes.
So, that is all the introduction, but the rest of it, I'll leave it to you. Briefly introduce yourself to the camera.
Hello, I'm Benjamin. You can just call me Ben. I'm currently practicing as a general practitioner in a private clinic. I've been working for about 15 years now.
Okay.
So yeah, I think that's about it for my career. Yeah.
Okay. All right. So today I'm going to ask you. Although you say don't want to talk about work, but I want to talk about work because in a way, I felt like this. I never really sit down with a doctor. Let me think about it. No, I never really sit down with a doctor to talk about what does it, how is the career like? Because when I sit down with a doctor, it's either I'm sick or somebody else is sick. Kan?
Yeah.
I mean,
true,
probably for you.
Family,
probably for you, maybe not. But for me, I've never sat down with a doctor and lepa or said, I don't have a doctor friend.
Why is there anything sad about that?
Okay, Ben. Before we move into the doctor's question.
Okay, all right.
I'm gonna do warm-up question, but I feel like this warm-up question, when I write it, also I felt like I put your career into the thinking process also. As you, what food would you avoid at all costs?
For me, I don't take raw food. Like those sashimi, raw food. No, I don't take.
Salmon, all this.
No. Even if it's salmon, I don't take it raw. I prefer it cooked. Yeah.
Okay.
And things like all the spare parts, like kway chap, or intestine, tongue, liver. No, that's not what I take. At all costs, I usually avoid. And all those exotic food, like locusts or this lobster. You see in Thailand where this all these things, all these insects and all that.
Oh, insects.
Insects. Yeah.
As long as it's exotic food.
Yeah, exotic. Yeah. Even like in locally we have this crocodile meat or that. I don't take it so.
So you never taken crocodile?
No. Snake, no. Because I feel like I can't really put myself in that position to put that kind of stuff into my mouth. Okay. So because they are like quite foreign things, I don't know. Because for me, like for example, I feel like they are not really clean food lah. If you put it in that way lah, yeah.
Don't you have a big friend who is like me, who like, hey man, try this, and the next thing you know, you put it on mouth?
No. I would look at it properly, see what is it, or probably smell. If I can't really accept the smell or the look or the taste, I cannot.
Oh, labi?
Labi.
What is labi called? Snapping turtle.
The turtle, the snapping one. No, never.
Never had it in your life though.
So cruel, you can kill all this.
I want to go against this one. How is it? How is it pig, chicken? How is it not cruel? And the animal too.
I mean, some animals are meant to be food, like poultry or that. No, they are red or that. No, for me I think some animals are a bit more like endangered in some way. Whereby you can't really breed them as fast as some animals. Maybe that's what I think.
Okay. So throughout your life, you have never had any of this? Or
No,
you never had any of this?
The only close encounter I had with a tortoise or a turtle was in China, in Guangzhou, in a big restaurant. When I went there for a tour with my parents, I think it was 1996. My first time over in China. Then there was this, you know, like this tour group. There was this big group of people, and they bring you to this large restaurant. And then they have all kinds of food served. Even along the way into the restaurant, there are a lot of cages around. Showed a monkey, eel, and all these animals that were caged up, you know. And then there was one a meal that they served was a clay pot. When they opened it up, there was a turtle inside there. The shell, the head, the legs, everything inside there.
Can see it.
Yeah, can see it. Yeah, everything is inside there. There was a soup. That was the closest encounter I had, but I didn't take any of it.
Oh, you just looked at it? Oh, okay. That is the closest encounter. Closest.
Just look at it. Cannot. I mean, of course, we do watch like documentaries and all that, no? You see a lot of this kind of exotic foods all around the world. Thailand, for example, Cambodia, and all the balut and all this thing.
So for you, it's because you think that it doesn't fit to be a food. That's why you don't consume it.
For me, like all this food, that they are either like scavengers or things like that. No, they are not very clean. No, and then what are the consequences after eating them? Like all this raw food and all this like uncooked things. Like you see like balut or this. It's like very unknown of or the side effects and all this stuff. Yeah, that's why I don't really take.
That's why you're a doctor. I'm not. I always, whenever I put this food in my mouth, I always tell myself this.
I think they are adventurous doctors as well who
This is just you lah.
This is just for me lah. I just feel like I should take something that my body can accept lah, that my mind can accept.
Like I said, I always take this food and I always tell myself I'm here for good times, not for long time.
Okay, that's your point of view. Nothing wrong about that.
Okay. We move on.
Yeah, sure.
It seems like when we talk about food, the topic get longer. Okay. Why this feel in the first place?
This feel lah.
Yeah. Why this feel?
Yeah, actually there was no really like a parental pressure lah, or I would say like no family pressure lah. Actually no lah. Not like a typical Chinese family. You must be a doctor, you must, or engineer, or architect.
I don't know why the accent come out.
Suddenly the Hong Kong thing come in. Never mind.
Okay, so your parents never told you that?
No. Actually, no. Actually, my parents, they are quite okay with whatever job we do. Yeah.
And then
not really like giving a lot of pressure. As in, hey, why don't you take up this course or that? Pressuring you to take up this course. Actually, no lah.
Okay.
I think most of us we go through a phase whereby when you're in primary school and all that, surely your what's your ambition? The typical response will always be teacher, bomba, police, all these typical ones. And then as you go further on secondary or that, then you start to be exposed to more kinds of subjects and things like that, and then walks of life. Probably you get more, you see more, understand more.
Exposure.
Yeah, exposure, true. And then things will change, right? Then even nowadays, there's so many people into IT, social media and all that things. So a lot of things will change now. But I think for me, I think as a young child, I do follow my dad and a few of the church people. We go to hospitals. We visit all these cancer patients a lot. Last time we had one ministry called the Smile Ministry, where we'll go and visit the hospitals in the cancer ward mostly, and then probably spread out to more general wards. And then from that point on, you see all these very sick people, very very sad looking. Some of them really at the brink of it's like very, very depressed at some point. So when you are there being with them at their most vulnerable point, then you see how happy they can be when you just spend time with them. Just a word of encouragement. That really made me feel like it's quite interesting, quite good to be able to do this, to be able to be there for them, at the point whereby, especially when they don't have very good social support from their family or friends, they feel very alone. And when you're most vulnerable, of course, is when you're either in a sick bed or you're incapacitated. So at that point, I felt that
How old were you when you were?
I think most teenager time. Yeah, so I think nowadays it's not that easy to get into the hospitals for a visit lah. Not like last time. No? Last time was rather easy. Like weekends not weekdays lah. So that time I really felt that there was a passion in me that really want to embark on this profession. No? So after SPM, that we got this opportunity. Then
anybody in your family, it's a.
No, my dad's an engineer. My mom is a stenographer. So no, there's no.
Still professional
even yeah,
Still
but there's no like even in my other uncles and aunties, no, there was no one in the medical field. Yeah.
Oh, okay.
Yeah. So
okay.
there was no family pressure or anything.
Okay.
Yeah.
Because again, I do not know whether it's actually good or not as an Asian parent to actually tell your kids to be a professional like yourself, right? Because I do know a family. This is also a family, but extended family.
All right.
The parents is actually they have a pig farm.
Okay. All right.
So pig farm, technically people are, maybe these people are not educated, like just raise pig, sell for business, pig farm. But they have three kids that I know. They're all very Asian type of professional. Doctor, engineer, architect.
Okay. The typical tree lah.
Yeah, the typical tree lah. So I always have the question, you guys somehow you'll be engineer. You'll be, Okay, so for you, it's never the case. So it's just you yourself.
I think it's just my own choice lah. Wow, I never had any pressure. Okay.
So do you feel that this is your true calling?
I think it's still up to now. After so many years, I still feel that it is the right choice lah. Despite many circumstances, despite many pressures in workplace, I'm sure everyone has a lot of pressures and stresses and issues, as from all the course of their career. But you're still I think as long as the passion is there, passion is right there, your focus is right there to help to bring about a change in someone's health from bad to good, and then to see how you can actually influence them in their life. I think that's a powerful thing to do.
Wow, that's good. That's really good. As in, I mean, I've talked to a lot of people now, and it seems like people that it's driven by passion is just different. Definitely different. But of course, I hope to talk to somebody that is not working on their passion yet.
Okay.
But I want to see how they have a different mentality, whereby how do you still drive yourself? Because for us, when we do what we love, of course it's a joy.
Yes.
Because there's a lot of people who would say that it's such a good thing because you get to do what you love.
Yes, true.
But I've heard a saying that. But then again, it's also easy to actually love what you do. Instead of the other way around lah. Because not a lot of people would end up like us who found our calling and say, I want to do this for the rest of my life. So. Okay, so talking about that profession, 15 years, that is a long time. That is a long time. What is the most extreme case that you have dealt?
Okay, I think this was back in 2015, if not mistaken, 2015, I think I was around that. I think it was I was still in GH that time, in ophthalmology practice. I was on call on that day, and then I got a really bad case. It was an uncle who got into an accident, car accident, road traffic accident. Then he had the injury over the face and also both of his eyes. So both of eyes got laceration. He had a laceration both eyes, and then it was like a penetrating injury from all the glass, shattered the windscreen or that. So I had to work on him pretty long. It was I think we were in the OT for almost 8 hours. Doing the suturing and everything. That was really bad because, first of all, it's very difficult to get penetrating injury. I mean, it's very rare. We don't really get it a lot. But over here, when you get it, and then somehow it's bilateral. Both sides. It's like really, you don't really get it a lot. And then the other thing is because usually I'm quite cool when I'm on call. I don't get like extreme cases like that.
Okay. So, that is one of the.
So that was like, so tiring. But in a way, after doing that, you get some form of like satisfaction lah.
Oh,
After you patch up everything, and then
Is he okay though?
one eye was unsalvageable, but the other eye was okay.
Oh,
yeah,
okay,
yeah.
okay,
Then
okay.
further follow up, I think remember that he was okay with the other eye. Then subsequently he was okay lah.
So that is the most extreme case.
Yeah, there was I think one of the for as far as I can remember. Well, there are a lot of others as well. I think there was another one when I was still doing my houseman in Cebu.
Okay.
2009.
Oh, okay,
2009.
okay,
I was in A&E, emergency
emergency.
department. Yeah, there was this case that came in. It was this guy came in with he had a bandage over the leg, and then the friend brought in the yellow boot, and the yellow boot. He was actually grass cutting, and then the blade came off, and then the blade went across the leg, and then the leg broke, and then his remaining feet is still inside the boot.
Yellow boot.
Yeah.
That should be your extreme case.
There was like one where I was like, wow, okay. You usually watch this or read this from like the emergency cases in the US and things like that. Yeah, but to actually see it right in front of you, it's like, wow, the feet is still inside the boot.
Is it retachable?
That time I don't think it was retachable.
Okay.
It was sent up to surgery, and then I don't think I don't quite remember what really happened after that. But yeah, it was quite extreme.
I mean, obviously, I've never seen it through hand, right? But the thing is, if we have seen movies or series that for example, you cut off your
thumb,
then you just need to keep your thumb cool and then send it to the hospital.
It depends on whether you have the expertise around. It's not easy to reattach.
Okay.
I think in Kuching that time we only had one surgeon who was able to do that. He was attached to Unimas. Yeah. I can't remember. It also depends on the viability of the part. Yeah.
So if let's say one day you cut out your thumb, then you're like, "Ayo, Dr. Wong he's in Switzerland cannot work." So you're like, "Okay this one throw away
It also depends. In America, it's very funny. In America, the medical is under insurance.
Yeah.
So it depends on your insurance how much you want to pay. So the thumb is very expensive because it's very important. If the other finger is not that expensive to treat.
Thumb is very important.
Let's say you don't have thumb, how are you going to grab something? If you lose your other finger, you still can grab something because your thumb is still there.
Oh, never thought. I thought pinky was true. I thought pinky was the least.
Yeah, because without your thumb, you try to hold a cup. It's so difficult. But with your thumb, you can hold it with any other fingers.
You cannot give thumbs up to people.
Okay.
Okay. So wow, that is a very extreme case.
Yeah.
Okay, I also want to ask, because this has been the reason that I give my mother that I cannot be a doctor. Because I have blood phobia.
Oh, blood phobia, right.
Yeah.
Right.
Do you have a colleague that has a blood phobia but still working in medical life? I bet not.
I think some have a certain extent of blood phobia, but not to the extent that they cannot work with like blood taking or that thing. Yeah.
Oh.
Some people they are okay doing it for other people, but not on them. You see, if you set line or you take blood for other people, maybe you're okay. You don't feel the pain. Don't feel. But if someone does it on you, then you look at your own blood and you feel a bit some people have that thing.
Oh,
they are okay with doing it for other people, but if it's on them, then they feel maybe for a short while it's okay. But if you persist there for a long time, if you're having trouble finding the vein, for example, then they'll say, no, cannot.
Oh, okay. I've never seen it. I've never looked at it that way. I've never looked at it that way.
There's a certain extent. I mean, as a medical practitioner, you during emergency time, you just poke in the line, the needle and everything, set the branular or whatever. You never think about how painful that procedure is. The person feels.
But for me, I don't think it's the pain. No, I felt it the moment the smell hits me. That's it lah.
I see.
The
hospital smell, you mean?
No. The blood smell.
The blood smell.
The blood smell. Like for example, last time I cut my thumb, right? But it's skin only lah. But I cut knife in like that. So the whole skin was like that. Right? So blood lah.
Okay.
I saw it like that. The first thing I call out is my mother. Ma! Then after that, my mom come. see the blood already gushing down, kan? That is when I smell it, when I smell it, immediately I have to hold on something. Cannot.
Dizzy already lah.
So then after that, my mom said, "What do you want to be?" I said, "Definitely not doctor." Okay. So that is the extreme case. How about the most unusual case?
But I think for our medical field, usually unusual is something that we rarely see. I think or things that baffles us. Things that we see. What is this? Sometimes you see specialists also looking at this. I really don't know what is going on. No? Sometimes they look at the kids and say, I really don't know. I mean, we don't know everything. No? There's some of the things that we need to refer to maybe senior people and all that. I think I remember one case in Cebu last time. Was a lady from the district hospital. I think it's from Pusa or something, very deep inside.
Pusa.
Pusa. 20 kilometers in. No? There was a lady. She had some skin disease, a lot of rashes and all this over her whole body. And then initially they tried treating her at Pusa or everything with the usual thing, creams and all that, ointments and that. Then it got worse and then she deteriorated and things like that. So she was sent to Cebu. And then when she came over, it was like also very baffling for I remember the specialist. He was like, this is like, it's not like very specific, especially for skin disease. You get all these kind of rashes, all these things are it's like the rash are all like look alike, like all these rashes, some of them look alike. Sometimes you don't know what is it exactly until you do a biopsy, things like that. So it was a very baffling case for us at the time. And then after doing the biopsy and everything, then referring to further expertise in KL, then it turned out to be a skin tuberculosis. Which was very, very rare actually. But in all these interior places, actually tuberculosis was one of the main, a lot of this infection going on. So it was like something like, because we always see tuberculosis affecting the lungs and things like that. So this affecting the skin, and then it was like all white spread over her back and all that. It was really...
I think I somehow, I don't read, but how come I felt like I read this somewhere? Because tuberculosis is what people call TB.
TB.
Commonly, right?
That's
so
right.
That is when it affects your lungs and you cough and it's bad. But it can also affect other places.
Yes, true. Actually, we call it extrapulmonary.
Prostate, was it one of it?
I'm not aware of that.
There's a part of your body whereby it can also affect it, and it's very rare.
Very rare.
So like the same thing go to your skin like that.
Yeah, it's very rare. It's like all these skin issues. Like it reminds me of the. Have you saw the Indonesian guy, the one with the warts, the tree man?
Yeah.
There is also something very unusual.
Okay.
So far, we haven't seen.
We haven't seen it here.
So extensive the wart.
That
was quite bad
because you also know my other interests, so I want to ask you as a doctor, have you dealt with cases like this? It's so unusual, and then specialists also like, I don't know lah. Then you like. Have you actually seen a priest? Have you came across that kind of impossible? This is not supernatural. Have you come across that kind of?
I do think to some extent. I've seen I experienced one before, like this within the family like some relatives
Okay.
They were watching a movie, horror movie.
Okay.
And then suddenly the one child fitted.
Okay.
So but everything was okay after that. Like the spontaneously resolved, things like that. Then brought to hospital, the usual CT scan, everything. Then everything was normal. Then the doctor actually said probably something related to the movie that was watching.
Really?
Yeah, because all this thing, I think. Somehow, if you watch all these things when you are not really, your mind cannot really accept it, sometimes you cannot take it, all these shocks, then sometimes you get into that probably some supernatural thing there as well.
Okay.
We can never defy that. No?
So next time the kid never watch horror movie anymore?
Don't know.
Okay.
But you can never defy the force there, right? Never know, because we can never do a test regarding that. Right? We can never. There's no evidence of any spirit ongoing or whatever. Right?
Okay. So we have talked about extreme cases. We have talked about unusual cases.
All right.
We have talked about. So how about yourself? Just now continue that a bit Have you actually seen of course you don't say it to the patient Of course you don't say macam. I think this is gauze lah. Of course, you don't say it lah.
Yeah.
Is there a unsaid rule or law that say, as a professional doctor, you're not supposed to look at it from
the supernatural aspect,
not scientific aspect?
I think it depends on what case law. I think if it's a very straightforward thing, like infection or a trauma, of course it's like a straightforward thing. Of course you won't think about any of that aspect lah.
But have you seen any cases that you, at the back of your head, you felt like, shit, this might be it, but of course you try to solve it professionally? Have you?
So far, I
no
don't
lah.
recall. Yeah, so far no lah.
So if you go to a doctor and the doctor tell you it's all ghost, probably that's not a good doctor. You go see other doctor. Every time you go to see doctor and doctor say ghost.
But in some countries, people when they say they see visions, they are regarded as psychiatric patients.
Yeah.
There are some countries like this. Yeah. Over here, not that much lah. Over here, yeah. People just say, oh, I see this, I see that, in my dream. Or say, oh, you're having hallucinations, things like that.
Yeah, we do agree that, although that is also part of my interest, but we do agree that because your mind, your brain is such a powerful, parts of your body, and it can put things in work in so many ways. Probably the things that we've seen lurking behind the shadow was not really there. It's just your brain telling you that, right? So, well, I'm not going to go too far because the podcast is not about that. Okay, if there is one thing that you can destigmatize about being a doctor, what would it be? Apart from the doctors are not always your parents ask you to be doctor. It can be you yourself want to be doctor also. Is there any other than that?
This is quite a difficult question. But maybe for the recent pandemic that we had, COVID-19. Maybe people always think that doctors are carriers of COVID-19 because they work together so close with the patients. So they are walking around freely. Maybe they are carriers of the virus themselves. Maybe. Maybe people think about that. I'm sure.
Okay.
So stay away from doctors, during the pandemic. Or you go home and then they say, oh, you're bringing germs from the hospital.
And shoot, today in the studio we have two. Okay. So people actually thought about it. I never thought about it.
It was actually quite a big thing, I think. Maybe not so much here, but you do get a feel of that. Maybe if you go into public transport, of course, of course, people don't wear the coat or that. But if let's say people know that you are actually a doctor and they're working closely with a COVID patient, people will actually stay far away from you.
Oh wow! I never really thought. I seriously never thought about it. I mean, probably my family also never.
For myself, that time I did not really work so closely with the very bad COVID patients at the time. Just it was a stable one. I was involved in taking care of those stable ones in the quarantine center. So, but we do wash ourselves before we leave the area. Everything. We have to put PPE, everything. But we still get this kind of thing from the public But not so much here, I think. But maybe in some other places.
I mean, after all, doctor is still human, right? You're also scared, right? You think, wow, doctor invisible.
Maybe that's
invincible. Normal, right?
The other thing, maybe people tend to think that doctors maybe like to hide things from them when they are doing their counseling or things like that. They're not really telling the whole truth. Some patients will give you that look, when you tell them, oh, it's like that, your diagnosis is like this, this is our line of treatment. They will give you that look like they're doubting you or things like that. Now, sometimes they'll think that they know more than you. They'll see that, I read this somewhere in Google, or ChatGPT told me this. Right? No,
this AI.
Yeah, true. ChatGPT told me that this is like that. Even give me a whole list of treatment options. Things
I print out this.
Print out this. Show you. See, you should be like this. The research show that so smart nowadays.
So that time you're like, you want to flip table? I go to school so many years to do this, to spend this kind of shit.
Right. Yeah, I think that's another thing. Probably some, not all maybe some of the, but we cannot blame them Some of these educated people, they want to know more. They just need nowadays. It's more about service rather than just touch and go.
Oh,
A lot of things that people nowadays are very educational now. They do read up before they come to you. A lot of things that they know. But the general population is still more to like they don't really know their medicine. They don't really know their condition. A lot of them are still like this. But they are a group that are deserving or they want more from doctors nowadays, rather than just a quick touch and go thing.
Okay. So do you see that as actually a good thing or a bad thing for people to be more cautious?
Yes, I think it's a good thing.
It's a good thing.
Yeah. I mean, yeah.
At the same time, you want to flip table when you talk to them.
Well, some of them are really very difficult to deal with. Some of them are really. Well, you just need to find the best. You need to find. You need to fine tune how you deal with them. There are different ways of dealing with different people.
Different people.
Some people are more accepting. When you tell them whatever, they'll okay, everything okay. So thank you, everything. Some of them they'll like, but things like that. But you have to just list down the options. Spend a bit more time.
So it's good in a way that they are more cautious about all this. So when you tell them, or they more become like a discussion how to achieve it better. Okay.
At the end of the day, they get what they want, and also we do our part by providing the options, and then they make their decision when this is A or B or C or whatever.
Now I suddenly think about this. Because my brother is a dentist.
Right.
I think I do not know because I have not been to the dentist for a very long time. Shit.
Who likes to go to the dentist?
But I want to know, does dentist do consultation before? Yeah, I always felt when you go to the dentist, the consultation is the tool is in your mouth and then you do consultation. How am I supposed to answer? The tool is in my mouth. Damn it.
Oh, I went to KIDC. I think last year. After so long, I didn't go to any dentist. And KIDC Kueh. Okay, that was my experience lah. Okay, straight away go in and then lie down. Then they shine the light, everything. And then they'll ask you, what do you want? Just a checkup or scanning. So they'll look through. The dentist look through, and then at the end of it, and then she'll tell me, oh, so you have this condition. So I'm going to do this thing for your this side, this thing for your this side. Are you okay with it? Then I think that's about it.
Oh, then they go through a checkup first. Then after that consultation, then you decide what you want to do.
Yeah, because I think they need to see what is. You need to open your mouth anyways, so for them to check first, then they'll know. It's not like something external that they can see straight away.
Probably I went to the government dentist
dentist. But of course, you can always, as a patient, you can always ask. You can always like when after they check, you say, okay, doctor, what are you going to do next?
Because I cannot I remember there is one particular tooth. I felt there's a bit of pain.
Okay.
So I went to set an appointment. I went there. Right. I went there. Then after that, doctor straight away I lie down straight away. The doctor, tengok. Only one word only. Cabut.
Injection.
Keluar already, I went back. I told my mother about it. My mother this is what my mother do. Exactly this. She was watering her plants. She take the cup that she was watering the plant. She take the cup and feeling. The word is feeling, not cabut. Feeling. I'm like, that time I wanted to just do feeling. Cause I don't remember the word. Doctor cabut.
Okay.
My mom feeling. That is when I'm like, I thought my mother was a lot smarter than me that time. That one particular time only. Okay, yeah. So I hope my brother is watching this, so he can tell me more about it later. Okay, a medical myth that people mention that is actually not true. Panadol can solve everything. That is not true.
I'm sure as a 80s, 90s kid, you surely heard mother say, boy, don't run after eating. Later get appendix.
Okay. Yeah.
You think I print money, is it?
So that is not true.
Not
right?
True lah.
That is not true.
Once you finish have your meal or that, you cannot run or that. Then you get appendicitis. That's not true lah. Because appendicitis doesn't happen that way.
It doesn't happen that way. And then care to explain how does it happen so that people know.
Appendicitis usually is like a pain pain over your right quadrant here, lower quadrant here. Usually it happens because there's like a small stool or something. Usually it's a stool or fecal matter that gets blocked in your appendix area. Then your appendix gets inflamed, and then infection sets in, and then up to the point, if you don't go to hospital early enough for an operation, then it ruptures. And once it ruptures, then it's very bad. You get all this peritonitis or this thing, which can be quite dangerous to your life. Usually it's always by a fecal stool, they get stuck there, they cause it.
Yeah, but kids, if you're watching this, still don't run after food. Somehow it's just, it might not be bad for your health, but it's annoying to your parents. I want to say that. But please don't. But okay, I want to ask, what is the actual function of that thing?
Actually, if you go online, you read about all this appendix, right? They usually call it a vestigial thing, right? It's like meaning it's like something that is not that important, something that is accessory, something like that. But actually, if you go and Google about it, they will mention it that way. But it's something to do with some immunity for your body,
it does help produce
some function, and then with something to do with digestive system as well.
I felt that in whatever belief system that we do believe in, I felt that the higher power doesn't somehow just create you and put you something this thing not important, but I'm going to put it in you anyway.
True. Yeah, true. Right. True. Like people will say that if you don't think that's important, I'll pay for the surgery for you to have it removed.
Yeah, like for example, I also felt that I have tonsillitis issue.
Oh, okay.
So whenever I have not enough drinks or body get heated up and that will act up, right? And
swollen
and the worst case is because I talk for living, so that it causes a lot of harm.
All right.
And I was like, actually, tonsillitis, what does it do in my body? Why not just cut it off? Until of course when I read it up, it also parts of the immune system as well. I'm like, and then why you act up that way if you are part of the immune system? Okay, but it's still inside, so I've yet to get rid of it.
That's how inflammation works, Get this swelling, redness, or that.
Then is there a part of our body that is actually not important, but it's there?
I don't think so.
I
think God is an amazing creator, Everything is there for a purpose, Human cannot recreate something that is. I mean, you see, look at our heart, all the things function so well, bodily functions, and then all of them are connected so well in a way that even when you do all this extreme activities, they still stick together. They don't break off. Every time I do like all this running or that, saying, I think, my heart is connected so well that it does not fall off when I'm running. It's like all these connections are so powerful.
Okay. Yeah, legit. I still think that way also. It's stupid, but when I hit puberty, I also thought pubic hair is so no point of having pubic hair. Why is it that? It's supposed to keep it warm, okay? Cold days, cold days. Okay. As a doctor, what is the best advice you can give to the public in general?
I think a lot of people know this. I mean, general health advice, people know eat well, sleep well, take care of your exercise regularly. I think all these things are very but to the point, do you actually do it or not? I think everybody has head knowledge, I think.
True.
But you must actually bring yourself to do it, not just.
Everybody know but to practice or not is another different story.
Nowadays you can get all this information online easily, from books or that. Online is like so much of information online. Everything can. But I think the other aspect is a mental health law. I think people need to take care of their mental health as well. It's something that is a taboo to talk about for some.
Still it is.
Later people think I'm siao or I kiss siao or I stress I depressed or if I talk about this, later people send me to psychiatric ward
which is bad. For me, which is bad.
Nowadays a lot. You see a lot, especially like I come across a lot of teachers having this depression, stress, and all this thing. And then it is really not talk about much I think. People nowadays rush everyday work. You work hard, you rushing day in day out, and then weekend also they feel like they're not motivated to do anything else. Maybe some of them continue work some more weekends. They don't have any free time for themselves, and end up everything is pent up. Everything is pent up. Then one day it just boom.
So to sum it up, is eat well, sleep well, exercise, take care of your mental health. That is
and then do it, not just
do it.
Do it, practice it proper. Just don't
eat well. You should know how to eat well. Sleep well. Is it truth in the 8 hours of sleeping?
Yeah, I think get as much rest as you can. You need.
Doctors also don't get 8 hours of sleep, especially when you're on call.
On call then different but you don't on call every day,
Okay. So you try to get as much 8 hours you can,
as much as you can, because rest doesn't mean just a nighttime rest, It can mean like a simple quick nap or what. It's also quite good.
You can break the 8 hours apart, right?
No. I mean, like if you have time, you just like rest. You can just have a time of rest whereby you just sit there, and listen to some music. This is also a part of
rest also, Okay. Now let's talk about a bit about mental health, because now I felt that we should invite the psychiatrist onto the show.
You should.
Yeah. Is there do you do you think that because we always we never really hear about mental health back in like let's say our grandparents' time, right? But somehow it's quite common today. Do you think there is a certain factor that causes that huge leap?
I think it's our way of life.
Okay.
Last time, people's lives are very simple. They live simpler lives. They don't have much pressure. Don't have much of not to say aim as in daily aim or aim in life, but they live life a bit more slow pace. Whereby you can imagine last time you don't have a lot of things like emails and all these fast moving things like emails, cars, or everything. You want everything fast. Everything was slow pace. So everybody is like, they just live accordingly to what they have or how they can. Nowadays, I think people are living very fast paced. Everything must be fast, deadlines to cover. So everything is just because the world is moving faster and faster. So all this thing I think is causing a lot of pressure, causing a lot of stress to people. And then that's what leads to a lot of this mental health issues. And then of course things like health as well. Once your health is not good, then you get all this kind of pressure as well.
How do we tackle that? I mean, the world is moving fast. You cannot just
you cannot break away from it.
You cannot like just chill we'll move right? But I also felt, correct me if I'm wrong, I also felt like last time, let's say you raise cow for a living, but you only get to see Mr. Bong next door punya cow farm, right? Then you got one. Then tomorrow you see, Mr. Bong got two.
Okay.
But you only have one person to compare, Then you're like, okay, I want to compete. And then you work hard, a month later, you got 4. Then Mr. Bong like, Mr. 10 now got 4. I want to compete. But this competition is very limited, as in, there's just only 2%,
True.
But now,
I get what you are saying.
You see like US punya Mr. Smith got like 20, then that causes
true.
Because the world is so open now, you know what is the other side of the world that's happening, and it's like that causes you to overthink about a lot of stuff.
True.
Then that is how. Do you think that is the thing?
Competition and comparison, I would say.
Comparison.
People tend to compare. That guy is doing better than me.
Exactly.
He's having more than me. So you feel like, is there something that I'm doing less or doing wrong?
And some more on social media, especially when you look at people put up their good side.
Yes, true.
Right.
Reality versus whatever. True. A lot of social media nowadays is maybe for not to say only teenagers get all this peer pressure. I think people of all ages you look at social media among your peers. Look at, for example, you look at how they travel. You look at how successful people are. People it's natural for people to feel that, oh wow, they are living like this. Why can't I? Or or why am I like this?
Yeah,
Or
yeah, that's
why
right,
why am I not successful like
That's
that?
right,
no?
that's right, that's
Yeah,
right.
people tend to think. Then when they do that, they'll feel like, oh, you're very, you feel yourself that you're very low, negative effects come in or that things. Yeah, I think it also affects someone.
Eat well, sleep well, exercise,
Yeah,
take care of your
exercise,
mental
mental
health.
health.
Don't look at social media so much, huh? Chill. Okay, if that's the case, then how do you release stress?
For me, I do exercise, outdoor activities. I like cycling, running,
Extreme sports, you do a lot of extreme sports,
hiking.
no?
Not to say extreme, I don't do flips and all that stuff. Just like riding outdoor. Yeah, I think that's what. I mean, when you're doing your free time, you do something else rather than what you usually do, like your normal weekdays. Do something else, read a book, read something else.
Oh.
It may be just something simple, just talk to a friend. You go and visit someone. And during your weekdays, you're also busy. You don't see people enough. You don't see your family. You don't see your friends enough. So weekend you can do that. Just talk to someone. You get some other perspective, some other insights. That's how you actually release stress. You need to have some form of communication. Humans, we are not actually built to be alone all the time. There are times where you need to be alone to reflect on things, to your me time but there are times that you need to relate to people too as well.
Humans are social animals.
Yeah, true.
So that is for you, huh?
Sports. Yeah, I do.
People.
You read a book. Go. We can just go by the beach, sit there, tea.
Is there a doctor who doesn't like to read a book? I never encounter one doctor who doesn't like to read a book though.
You can read other book not read medical book
Don't read Facebook only.
That's
not a book.
yeah,
It's
that's
a
not
name.
book Yeah.
Okay.
Don't go hiking in Bukit Bintang only.
Okay, that's a good one. I give him an A. Okay. Don't go hiking in Bukit Bintang only. That's no good to you, Okay. So, briefly, just tell us, how is it like in a day for you, normal day, as a doctor?
Same like everyone also same Wake up, brush your teeth, shower, eat breakfast. Not like you don't eat breakfast.
Kena tembak terus referring to me and Peter, the producer. We don't eat breakfast this morning. He ate breakfast, okay.
For me breakfast.
Breakfast.
There's work law. I think usually I think the major bulk of doctor's life is patient relation. Doctors and patient relation. Then the main bulk of it is like talking to your patients. Helping them establishing a diagnosis or what's the issue, and then coming up with a set of treatment options and things like that. I think that's a main bulk. Some doctors go into other things like surgery or some people do outreach. Outreach. You go to the villages and you do outreach. Do screening, health screening or that thing, health talks and things like that.
You do that also.
For me, I do outreach as well. Last year I did one. I think it's interesting I think same also We also what else I do as a day. Something like that, just patient relation mostly.
So after work, then after that you end work,
then go home, sleep then the next day the same thing again, repeat again. I think it's something like that. Just the only difference is the patients that you get different people There's something interesting also You meet different people all kinds of people, different issues of life. That you just need to come up with something to help them.
On the stress level, how would you rank yourself? 1 being the lowest, 10 being the highest.
Stress level at work.
At work. Of course, when you eat breakfast, there's no stress.
No stress.
At work.
I think it depends on days. Some days you just feel a bit more not yourself, or maybe I'm sure everyone has that those days Then I wouldn't say it as stress I would say it like probably you woke up on the wrong side of the bed or what. Or you just don't feel maybe sometimes you feel like a bit like, okay, today is just not my day, things like that.
Oh,
Yeah.
okay.
But if you want
On
to
average,
say,
on average.
but you want to say on the stress level, I think it depends on what we meet lah. Some people are easy to manage. Some cases are easy to manage. Some are like, wow. Why this kind of thing come? Especially if they have that complaint for a very long time, then they only come to you at the very late stage. Then it's like, ayo, then probably stress go up to about 7 or things like that. Then on average about maybe midway lah.
Okay.
3 or 4 or 5 lah. On average is around that lah.
Oh, okay. 7. Okay lah. Probably because you like what you do lah. Then the stress level become lower lah.
Yeah.
Imagine there are people who like, I don't want to be a doctor. I want to be a dancer. Like what comedian Joe Coy said. Then because your parents want you to be a doctor, so of course your stress level high lah. Because you like every day you sit there like, I don't want to be here.
It all depends on what motivates you lah.
Okay.
Yeah. If it's like helping people and then you have passion there to care for people, then it should be alright lah.
Okay. So I think that comes. We have one last question, whereby like the show name is called Feel Good.
Feel Good.
So for you, what is your feel good? It can be a quote, it can be a saying, it can be an ideology, or something that gets you on when you're like, today is not my day, but this is what you think about. What do you think about?
I think what usually when people ask me about this kind of thing, what is my principle in life or things like that.
Okay, yeah.
I always say be humble, stay humble. Be humble and stay humble.
Okay.
Yeah. I
Be humble, stay humble.
Once you have that, then it's easier for you to relate to all sorts of people. It's easier for you to love people. Then you can relate with any kind of people. There's no problem for you. And then I think that's a very important trait to have lah. No matter how good you are, no matter how high you have achieved or what you have achieved, always be humble lah. We are here for a very short time. We are not here for a very long time. What we can do is just so limited, no?
Yeah.
Who are we to be so think so highly about ourselves, right?
Yeah, because remember, in centuries' time or even 1 millennium later, your existence doesn't matter.
Yeah. You look at the Queen of England, funeral thing. Then the next day, the 2 days after that, nobody talk about it.
Gone already.
Gone already, no more.
Yeah, people might remember her, but that's it lah.
Nothing, that's it. People go on with their lives already,
Okay.
So, yeah.
Thank you very much, Ben, for coming in the studio today. And this is actually, when we record this is actually a weekend. So I'm actually taking away his cycling time.
No, it's raining as well.
Okay. If let's say, do you want people to follow you on social media or?
You can check me out on YouTube lah.
YouTube.
Adventure.
Finally. Because I don't want to say because I don't know, guys. So he puts up his personal interests.
Vlogs.
YouTube as a blog form lah. So YouTube, what do they search?
Adventure. You know adventure?
Yeah.
Adventure. Yeah. Just change the V to B.
ADBEN
TURE.
Adventure. So that is where you can follow up Ben with his personal interests, more to personal interests. You never talk about work there.
No, nothing.
Okay. So once again, thank you very much, Ben, for coming in.
Worries.
That's all for this episode. We'll see you in the next one. Again, if you have yet to subscribe, remember to click on the subscribe button. And thank you very much. Ciao.
Ciao.